Becca, today we had a conversation about the pelvic floor and how it relates to back pain. Tell us about the relationship between pelvic floor and back pain.
The relationship between low back pain and the pelvic floor are the muscular and fascial connections, right? We have the muscular connections. Almost all of the pelvic floor muscles connect onto the lower parts of the spine, being the pelvis. And fascially, we're connected really through all parts of our body, but really throughout the trunk and down to the pelvic floor. So it's difficult to engage one area of the body, for instance, the pelvic floor, without the transverse abdominis coming on. Or every time we breathe, when we inhale, our diaphragm drops down, and when we exhale, the diaphragm pulls up and the pelvic floor comes with it. So there's just so much connection within the trunk and especially the pelvic floor.
Yeah. So we were talking about Kegels for a minute.
Yeah.
You were talking about how around 50% of women do Kegels improperly. Why is that?
I think it's because they were just never taught how to do it. And only recently have women really been taught to be in touch with their bodies. And that definitely hasn't been going on in the older generation. So if I have someone who's, even between 60 and 90, they've never been taught how to strengthen their pelvic floor. They're mostly doing it incorrectly, so it takes a while to connect that pelvic floor with their breath.
What advice would you have for someone that feels that they have a pelvic floor issue, whether it be leakage when they cough, sneeze, or jump, or maybe they have urgency, they have to go to the bathroom a lot of the time? And what advice would you give to them as far as understanding how to do a Kegel?
Ooh, that's a hard one because it's so individualized, right? In what works even verbally with one patient doesn't work with the next patient. And so, number one, get into your pelvic floor physical therapist, right? If you're having any of those issues. But taking the time to listen. So as you're breathing, paying attention to what's happening at the diaphragm and knowing that the diaphragm and the pelvic floor work in tandem. So as your diaphragm drops down with your inhale, your pelvic floor is dropping down. And as you exhale, when you really start to pay attention, that pelvic floor is lifting as well. And so start making out that kind of mind-body connection and paying attention to that part of your body.
So I think a big question that patients have, if they have this leakage later in life, is this something that's correctable? Is this something that they can work on?
Yeah. I haven't had a patient that hasn't.
Yeah, it's great.
Yeah.
All these things can be corrected even later in life. It's just a muscle retraining problem. Yeah. And a coordination issue, and we just use those, we teach those muscles how to coordinate together.
Yeah.
Tell us what an exam looks like. Maybe a patient's a little afraid to come in and get a pelvic floor exam. Tell us what that looks like.
Yeah, that's understandable because it can kind of be intimidating with someone looking at your pelvic floor, right? And so for my patients, everything is an option, right? They're in control of everything about the eval. So an eval is not unlike a regular PT eval where we look at how you're moving, the range of motion in your hips, how you're walking, your strength. And then when it comes to actually looking at the pelvic floor, we have three options. We can do an internal and see what's going on. Secondly, we can feel the pelvic floor over the clothes. And thirdly, we don't have to touch your pelvic floor at all. We can most of the time determine what is going on by just talking about what the symptoms are, which is why telehealth works very well with pelvic floor therapy as well.
Yeah, absolutely.
Yeah.
So another question is, someone that has pain with intercourse. This is a very common thing that we see in clinic. What are things that people that have pain with sex, what are things that they need to be worried about, or things that they should be asking to fix those issues?
A lot of times pain with intercourse, in my experience, so in my practice, has been due to past sexual trauma. Number one, outside of physical therapy to learn how to release the pelvic floor and find out what the physical problem is with that, is what's going on in our minds, right? What past experiences have we had that lead to this pain. And so all of my pelvic floor patients that are dealing with that have either come from a sex therapist, or I make sure they get into sex therapy as well, because we're not just parts of our body, but a lot of it is parts of our mind.
Yeah.
And so,
say someone that's had back pain for a really long time, how does that tie into the pelvic floor? How do they start compensating and creating an additional problem?
Yeah, so it depends, right? It depends on are we having too tight of a pelvic floor, or is our pelvic floor not turning on correctly? So due to the connections that we talked about earlier, the answer is always it depends. How do we need to, what's going on in the spine and what's going on in the pelvic floor? And then you design your treatment around that.
Yeah, ultimately, with the pelvic floor, it's testing it to figure out what's going on. Mm-hmm. And that's why in the physical therapy world, we use the term "it depends," because it depends on a lot of things. You know, if I was to prescribe you glasses as an eye doctor, they're very customized to your eyes. I can't take your glasses and put them on me. And that's why a lot of it depends on the exam. We don't apply treatment. We don't prescribe Kegels unless it's appropriate to prescribe Kegels.
Sometimes Kegels is the worst thing for a person.
And I think a lot of people need to hear that.
Kegels. Yeah. Sometimes I never want a patient to do a Kegel. It's not unlike low back pain, right? Your low back pain might look different from patient's B low back pain. And so if I treat them opposite, we could cause more harm and more pain.
Yeah.
So it's very, very similar in the pelvic floor.
And you talked about releasing the pelvic floor. A lot of people hold so much tension through their pelvic floor, they can never actually relax it. Right. And that's why prescribing them a Kegel would not be helpful and actually would increase their pain. So if you don't know how to do a Kegel appropriately, you should find a pelvic floor physical therapist that can teach you how to optimize and to use those muscles in coordination with each other.
Right.
But I love this topic. A lot of women just kind of shove it under the table or under the chair and just don't talk about it because it's embarrassing or they're afraid to talk about it. And this is just something that's correctable. It's something that is manageable, and we can teach you how to use those muscles again. Is there any last advice that you'd have for patients with these issues?
Yeah, it's not just women. It's men too. Men
have a pelvic floor.
Men have pelvic floors as well. And so this isn't just a women's issue. It's a people issue. And so it's often overlooked, and it can easily be corrected.
Yeah, absolutely. Well, thank you for that conversation today.
Thank you.